When I last left you, we talked about different types of cross-sectional imaging. We talked about different projections, in a sense, how we view radiographs of cross-sectional anatomy. So we know what is the primary way that a cross-sectional anatomy is obtained.
Axial?
Axial, absolutely, it's axial. So when we're looking at axial, this is how, when we actually lay the patient down in a recumbent position on the table and they are moved into the gantry of the CT or the MRI machine, the images that are acquired are always going to be an axial. Reconstruction of the images in coronal or sagittal has to take place by a mathematical algorithm. Okay, so there's a lot of math going on in cross-sectional imaging, a lot of math called algorithms, they're formulas that are used to reconstruct coronal and sagittal images from an axial image. How do we view an axial image?
Inferior to superior?
Inferior to superior. So I'm looking and I'm pointing right here. Is this the left or the right side of the patient?
Left side.
It is the left. And it's kind of similar, isn't it? It's kind of similar. The left of the side of the patient is still corresponding to our right side. Same way if we were looking at it coronal, correct? Coronal, this is the left side of the patient. We're not changing the way that we view the radiographs in a coronal image. So we're not changing the view of left side over right side in an axial image. Okay, good, perfect. So what we're going to pick up today and what we're really going to concentrate on is looking at different types of images, making sure that you're ready for Wednesday's exam. So I want someone to tell me what kind of image is A. Matter of fact, you know what? I want you to type it in. I want you to type it into the chat. I want everyone to type it in. Get you some finger action going. Great. So I'm seeing coronal images. And what is this a coronal image of? Go ahead and type it in.
Lungs.
Good. It is of the abdomen. What gave it away? Anyone, you can say it out loud. What gave it away? The vertebrae? Okay, I like that. And you're also going to be able to see the vertebrae a little bit more clearly in the lumbar because of that. What kind of curvature does the lumbar vertebrae have? What kind of curvature does the lumbar vertebrae have? Lordotic. Very good. Very, very good. Perfect. So we are able to see the lumbar vertebrae more clearly because that lordotic curve, the vertebrae bodies are positioned more anteriorly as opposed to the thoracic. Good. I want to go ahead and go down to C first. What kind of projection is C? What kind of projection? Axial, sagittal, or coronal? I see some change-ups here. I see a lot of coronal, and that is absolutely true. We still see the patient's left side, and we still see the patient's right side. However, what we don't see is what we saw here in this one. We still see the hips and the ilia. We see the hips and the ilia, right? Here, here, a little bit darker. This is an MRI. This is a CT, a little bit different. But the concept is still the same. Here we have the iliac crest. Here we have the iliac crest, iliac crest, iliac crest. However, we don't see the vertebrae, do we? Like we see it here. So my next question is, which one is a more anterior slice, A or C? Which one is a more of an anterior slice, A or C? Good, Miss Jaleisha, I saw that you put C. Tell me why you think C is more of an anterior slice over A. You are correct. So tell me why C is more of an anterior slice over A.
Because in A, you can see the spine work, which is more posterior than what you can see in C.
Absolutely. Bravo. Yes. If you can see the spine, because the spine lies, or the vertebrae lies most posterior. It is the most posterior, even though there's a lordotic curvature. Once you get past the spine, there's really nothing else other than muscles and then skin. So here we're able to see, what does this give? What is this image of? What does this look like? Thank you, John. What is this? What is this anatomy? Psoas. Thank you, John. Psoas muscles. It is psoas muscles. And then we're also going to see some type of vessel. Here we have the aorta. Okay, great. You guys did an awesome job. So you can not only did you see that this is a coronal projection or image, sliced image, coronal, but you were all also able to say which one was at a slice more posterior versus anterior. Make sense? Good. And so how do you prepare for that? Well, you have to know your anatomy. Okay? Now, what kind of projection is B? Type it in. Very good. I see a lot of axials, and that is absolutely correct. And so we're going to spend some time today looking at some of the anatomy, and we're able to see, but when you think about this and you're looking at this, because this is obviously foreign to you, we've been looking at radiographs holistically, where we see the liver and the kidneys and the psoas and the intestines. We see all of those superimposed from each other, but here it's like slicing a piece of cake. You're only going to see a certain slice. If you were to slice a piece of cake, you only have that slice, right? You would see from one side to the other, and this is how we're taking those images. So when you start to see masses like this and bony material or anatomy like this, and you start to see other items, it kind of gives you an idea of where you're at, okay, of where you're at in the body. So what side is this that I'm pointing on to right here? You can say it out loud. The left. Right. So right side. Remember, you're looking at inferior to superior, just like we view a radiograph. If this is the patient's left, this is the patient's left. Okay? If this is the patient's right, this is the patient's right. This patient has just they laid down recumbently. Okay? So we have a huge, huge, huge organ on the right side that occupies predominantly a large amount of space, not only on the right side, but some of the left. What kind of organ would this be? What kind of organ mimics this type of shape as well that lies on the right side? I see it. Good job, guys. A lot of you are saying the liver, and we know that the liver occupies the right side. If you forgot, This is a great opportunity for you to go back and refresh your memory. Okay, so this is the liver. It looks somewhat different, right? Somewhat different. And so it could be gases, but it could also be pathology to mimic, not gases, but depending on where it was cut, it looks not so solid. Okay, now D. Tell me what kind of projection is D? What kind of cross-sectional image is D? Right, sagittal. We see the anterior and we see the posterior, but we do not see the left and the right. So this is the patient was sliced sagittally to obtain this image. The patient was sliced sagittally, okay? Removed the left from the right. Does anyone have any questions about what we just went over? Good. So what are your body cavities that we're going to talk about or we're going to cover in this section of Introduction to Cross-Sectional? We're going to look at the thoracic cavity and the abdominal pelvic cavity for your test on Wednesday. We're going to look at the thoracic cavity and the abdominal pelvic cavity for your exam on Wednesday. You have already covered the anatomy portions and radiographic procedures 1. Okay? So this is a review. If we were to go back and say, where does the thymus, where's the thymus located? Heart, great vessels, trachea, esophagus. Pericardium is just the sac that surrounds the what? The sac that surrounds the heart. Very good, Jonan. Good. Lungs, pleural membranes, and then the abdominal pelvic cavity. We have the abdominal area versus the pelvic. And then I'm pretty sure you're going to be able to locate these items. So anatomy will be on your exam on Wednesday. Anatomy will be on your exam on Wednesday. So spend some time reviewing. Another item that is big in cross-sectional anatomy is not only knowing where your organs lie, but at levels. When we think about the word levels, now we know that your vertical axis of your central ray is likely going to be placed on the mid-sagittal plane if we're including both sides, right? Everything that we're going to do, if we want one side and the other side, we're likely going to place it at the mid-sagittal plane. That's the vertical axis. But the horizontal axis defines what our objective is. Now, I'll ask this. Where do we place our horizontal axis if we want to image the entire thorax? T7, perfect. T7. So we know that if we want the entire thorax, it's going to be T7. When you guys get into spines next semester, when we're looking also for the thoracic vertebrae, it would only make sense that we would still aim at T7. We're talking about the horizontal axis. So when we look at C5, what did we position in your history of learning? What did we position around C5? What was our objective? Upper airway, absolutely, Isbeli. Upper airway. So we knew that if we were going to place our level or central ray horizontal axis at C5, we were not looking for the thorax. Our thorax is not the objective. The airway is. Make sense? So what other landmarks or levels did we learn, which we call them topographic landmarks? These are levels where you can actually palpate on the patient to determine what anatomy or where to center and roughly get an anatomy of what is there, a layout of what anatomy is there. So we have T1. What lies at the level of T1? Two things that I'm looking for, two bony anatomy that I'm looking for that lies at the level of T1. A jugular notch is going to be a little bit lower at T2, T3. What lies at T1? Clavicles? They lie a little bit. The vertebral prominence. Perfect. The vertebral prominence slants down so that it lies at the level of the body of T1. So the vertebral prominence or the spinous process of C7 slants down so that it lies at the level of T1. Good job, Naomi. Give me another one. And maybe somebody said it, not Adam's apple. Adam's apple is over here by the thyroid cartilage. Manubrium and jugular notch are the same thing. The manubrium is actually, the jugular notch is the dip of the manubrium. The manubrium spans between T2, T3, all the way to T4, T5. Let me see if somebody said it.
Did you say a bony anatomy or just
Bony anatomy? What else lies at the level of T1? Your first set of ribs. First set of ribs. Posterior ribs. First set of posterior ribs lies at the level of T1. So we know. So why is the vertebral prominence so important? When we're centering, we want to make sure, or when we're opening up our collimation, because if you have the light above the vertebral prominence, then in theory, you have the entire apices of your lungs. Make sense? Because your apices do not expand more superiorly above your first set of ribs. Make sense? Good. Let's look at the sternal angle. That's at T4, T5. So what does this basically mean between at the cartilage between T2 and T3? So the sternal angle lies at the cartilage level between T4 and T5. And then we have the xiphoid process. The xiphoid process tip will lie between T9, T10, depending on the thorax size. Got it? Any questions there? So this is a review. Make sure that you go back over chapter 2 and your bond trigger so that you can go back and review. Now, why is this important? Go ahead. Question?
Yeah, I was just going to ask, so the vertebral prominence is at T1 or C7? Because that's how I remember C7.
Vertebral prominence belongs to what vertebrae, Jonan?
I mean, I thought it was C7.
C7. You're absolutely right. But it slants down.
Oh, I see.
So
I see
when
what
it
you're saying.
slants down, it lies, that vertebral prominence lies at the level of T1.
Okay, I see what you're saying now.
Good.
Okay.
That's why touching or palpating the vertebral prominence places you right at the same level of the ribs, posterior ribs, number 1. So its significance is so high that if you do not have light or you clip the vertebral prominence, chances are you are clipping what? Not chances are, you are clipping what?
Apices.
Apices. Good job. Perfect. So trachea. We know that the larynx lies, the whole larynx, and we're talking about the hyoid bone. The hyoid bone lies at the level of C3, around C3. And we know this thyroid cartilage, the thyroid cartilage, or the Adam's apple, laryngeal prominence is right here. The laryngeal prominence is right here, or the Adam's apple is part of the thyroid cartilage. And we know that that's around C5. At C6, or right below the Adam's apple, or laryngeal prominence, we know that we have the trachea. The bifurcation, which is called what? Karina. Perfect. So here we have it. Here we have the bifurcation at the level of T4, T5. Not in the middle of the chest, superior to the mid-thorax. Superior to the mid-thorax. So why is this important? Well, when we start to get to images, axial imaging, axial imaging, right? We know that if we were going to separate all of these images, all of these slices away from each other, we are going to have, let's just say we moved A away from B and B away from C and so on and so forth. Now we have to go back and figure out how would we put this puzzle back together based on what we see. In this image, we see humeri. Makes sense, right? We see both one left humerus and we see a right humerus. What we're looking at is an X-ray. This is an X-ray. We see humerus, we see heart, we see lungs, we see liver, we see all kinds of things, right? But we know that once we slice this, we're going to be seeing it inferior to superior. Does everyone kind of see where I'm going with this? Yeah? So here at this level, at the level of T1, what are we going to see on this slice? We're going to see a part of the clavicle. We'll see some AC joint. We'll see the humeral head, some of it. We'll see some humeral head. Here's a coracoid, so on and so forth. Let's go into B slice. Tell me what you see in the B slice.
The B slice isn't it BVN?
Clavicles.
Okay, so we see some clavicles. Good. We don't have time to check because we're going to be running out of time here in a little bit. So we also see what is big, what is huge here. We see apices, don't we? Yes, we see apices. So we would see some dark areas on this slice along with a lot of bony anatomy. As we move further down, we start to see more of the lung, right? However, we also see the tips of the clavicles. Why is this making such a big deal? Because if I took G and I separated it from C, would you be able to tell me which one lies more superior versus inferior? Because that's how we see our axial images. Make sense? So I'm going to pause right here and let you ask questions. All right. So no questions. We'll continue to move. So this is a little layout of what anatomy, and it has a lot of anatomy on there. I really want you to make sure that you know the main organs like you learned in Von Traeger chapter 2. But here we have, what is this called right here?
Carina.
The carina. What level does it lie at?
T5.
T4, T5. Perfect. So we know that we're at T4, T5. Where does the first set of ribs lie at?
T1.
T1. Perfect. Now, let's take a look here because we know that we should not see any more trachea as we get down to where our diaphragms are or where our liver occupies, right? So we no longer see this trachea, or we see a larger heart, a wider heart over the lower part of the thorax. So these are key anatomy points so that let you identify how inferior we are versus superior. Make sense? Good. So let's take a look. Sagittally. We know that the vertebrae lie most posterior. We know that the vertebrae lies most posterior. We know that the ribs are even more, posterior ribs are more posterior than the vertebral bodies. Anterior to the vertebrae, we know we have the esophagus and we also have the trachea. We have the esophagus and we also have the trachea. Anteriorly, we know we have the apex of the heart. We have the apex of the heart. So the heart slants from posteriorly at the aorta all the way to the apex. It slants anteriorly. when we do sagittal projections, we want to see what is most anterior versus most posterior. Make sense? Yes? When we're talking about, not sagittal, I'm sorry, we're looking at coronal imaging. So what is most anterior versus most posterior? Okay? So coronal, if we were to slice down this patient coronally, what is most posterior versus most anterior? So let's take a look. Let's go ahead and check yourself. We're looking at this image. What kind of image is this, Daniel? What kind of slice is this that we're looking at?
Talking about the top or the bottom? That is I'm lost right now. Axial. Axial.
Well, I want you to pay attention to this, Daniel. Here is the spinal cord. Look at your information. So this is the back. Then this has to be the front. Duane, what is it?
The axial slice.
It is an axial slice. So we have just a segment. So what we did, Daniel, is we sliced this patient this way. We sliced this patient. Patient was like this, and we sliced them axially or horizontally. And so what we did is we separated all the other sections. So this is pointing to the liver. Miss Betty, is this high or low on the thorax?
It's high.
The liver sits high on the thorax?
Well, it's on the right, and it's right upper quadrant. So wouldn't it be?
Is that the abdomen you're talking about? I said the word thorax.
Lower.
Good. Perfect. So the liver lies in the lower border of the thorax, right? It actually lies in the abdomen, but we see a good deal of it. So we know that this is more abdominal region as opposed to thoracic region. Make sense? Because what is missing? We don't see lungs. So let's take a look at this image, Asias. Here we have, what kind of projection or what kind of slice is this?
Is that maybe sagittal?
Let's take a look. So right here, we have a humerus. We have glenoid cavity. We have a glenoid cavity. We have clavicle. We have trachea. Right humerus, left humerus. This is an axial image. Okay? This is an axial image. And if I go back and I look at what type of axial image, could this be? Chances are it's going to be which one? Which one? A, B, C, D, E, F, or G?
A or B?
I like A. Because I don't see what? I don't see any lungs. Lungs are going to look very, very dark. Good job, guys. Good. So, what does this mean? As you start to prepare, you need to kind of look at, and we'll go over some more images, but you'll need to kind of look at what you can see or what you can't see versus what this is. You can see round and white. What does bright mean, Asias, on a radiograph?
Is that radio opaque?
It's radio opaque. So what is radio opaque in our bodies?
Can absorb it.
But what kind of anatomy do we have in our bodies that's radio opaque?
Mainly bone.
bone. So we know that this is bone. What does this color right here would indicate what, John? Air. Perfect. Now, what air, or where could air lie anterior to our vertebrae? Trachea or esophagus, right? Depending, it's going to be either or. So this is going to be the esophagus, and this will be the trachea. So if you go back and you look at this, where does this mostly fit? And it would be A, because I don't see lung. So what would lung look like? Let me see if I have an image. No, I'll have to let me go back and find an image. Okay, I found an example. Let me go back and another example. Okay, this hopefully will make it a little bit clearer. Okay, so let's take a look at these two. Now we were here, we saw humerus or bone. What would be round, right? Here's your vertebrae. Always look for your vertebrae. Look for your vertebrae when you're in an axial projection. See what's around the vertebrae. Look around the vertebrae. See what's going on to the sides, laterally. What is happening anteriorly? Okay, so this is the way that you'll start to look at these images. So when we look at this image here, find your vertebrae. That's where you go first. You see that this is bony. It's right in the middle of your image, of your slice. Look laterally. We see some ribs. I can see a transverse process, and I know that you don't know the anatomy just quite yet, but I want you to look at your vertebrae, and I want you to see what bony anatomy lies there. Also, immediately beyond that, we see space. We see darkness. We know that that is air, right? So we have round. It's either going to be the thorax or the abdomen. It's not going to be anything else. It's either going to be the thorax or the abdomen. Make sense? Yes? Good. So immediately lateral, you're going to see space. Immediately anterior, you're going to see space. So looking at this, what do you think this space or what this anatomy could be that would give it a dark appearance, Amy?
The base of the lungs.
Base of the lungs? What do you think this is? What would be round bony material? What would be round like this that makes there's a joint?
Those are the humerus, so that would be the top of the apices of the lung.
Perfect. See, this is where the critical thinking comes in. Look to see what you have. Look at the shape. It does not change. Okay? Look to see what you have. Now let's take a look at this one, Aurora. Here we have the vertebrae. Look for your vertebrae. We don't see, we see a lot of space around, a lot of space, and immediately anterior, we see there's some areas of brightness, okay? So around the vertebrae, we see lots of space. What would this be an indication of?
The lungs.
The lungs.
It will be more.
They're bigger, right?
Like it will be more. Yes.
So Javier, which one is this one? Which one lies more superior? Is it this one or is it this one? In the thorax. They're both thoracic images. This one or this one?
No. That one, the bottom one.
This one lies most superior because you have more bony anatomy in the form of humeri, right? We have less lungs. And here we have a great deal of lungs. And the widest portion or the widest section of your thorax is at what level? At what rib level? The widest portion of your thorax. The highest width. The greatest width. 7. Like it. Rib 9. At rib 9. Got it? Let's go back over your... So I'm going to stop at thorax. Does anyone have any questions? Okay. All right. So abdominal quadrants. We have 4 of them. As Betty mentioned, we talked about the right upper quadrant. But now we're in the abdomen. We are in the abdomen. You have the right upper quadrant, left lower, and right lower. There's also different regions. We have 9 of them. We have the right and left hypochondriac, which is right below the ribs. We're going to find the liver in the right hypochondriac. We're going to find the spleen in the left hypochondriac. Okay? Epigastric, or right above, you're going to see the liver and the stomach. At the area in the umbilical area, we're going to see it's largely occupied by the small. So I want you to go back over. You've already gone over this information. You've already covered this information. It's not for me to cover it again. It's for you to go back and review it. Well, why is this important? So that when we start looking at cross-sectional images, you have an idea of where everything lies. In reference to landmarks. So if we go back over this page in your chapter 3, you would know the lower abdomen and pelvic landmarks. T1 takes the shape, 1 takes the shape of the what?
Carina.
That's not carina. Carina is going to be up here. Xiphoid process, which lies at what level, John?
T9 to 10.
Here we have the lower rib margin. The lower rib margin, or the hypochondriac area, is going to be L1. Here we have the iliac crest. The iliac crest is going to lie at what level? I see a lot of different ones. L4, L5. Here we have the as-is. The as-is lies at the level of S1, S2, sacrum, sacrum 1, sacrum 2, and then we start to go further. The pubis symphysis. The pubis symphysis lies at the same level as the greater trochanter. So I should see the center of my hips, or the greater trochanters, at the level of the pubis symphysis. They both lie at the same level. Okay? So I want you to make sure that you go back through this so that you're able to understand what anatomy is going to be required where. Where is it going to lie? Okay? So L4 and L5 at the iliac crest is where you're going to have, or right here, L3, L4, you're going to have the umbilical area, which we know is going to be occupied mostly of what? Small intestines. Okay, so when we're taking a look at this, this is what kind of a color view of what kind of projection, Jaleisha?
Coronal view?
Coronal. Good, Justly. Now, we know that this is the liver. What would this be?
The stomach?
Very good. Very good. Did you say the stomach? Okay, good. All right, but I think someone answered for you, Justly, so I'm going to go ahead and go back. What is this right here?
Yeah, they answered.
Which one? Is that the gallbladder?
Gallbladder would be a little bit more tucked in. It takes the same shape as this one.
Oh, the kidney.
Very good. Very good. Perfect, perfect, perfect. And we can start to see as we go down the iliac crest, down the ilia, we know that we should see the sigmoid, the rectum, the bladder, and so on and so forth. So use your landmarks. Take a look at what you see. So when we're looking at the abdominal pelvic cavity, here, high at the abdominal pelvic cavity, we're going to see some lungs. As we start to descend inferiorly, we see less of these spaces, and we're going to start encountering more tissue. So if we start to separate these axial slices from each other, we're going to be able to determine where we're at from what we see and what we don't see. Okay? So taking a look at this is an abdominal axial projection. This object right here, Jolie, what is it? Here's the vertebrae.
Is it the liver?
It is the liver. So this is the right side. We know that this is the patient's right side. And we see a lot of liver, don't we? And we could go back, and I'm not going to ask you to label the spleen, but there it is. But if I went back and I looked, here is my vertebrae. And we see less liver than we did here. You see this? Less liver than we see here. Which one lies more inferiorly? Image number 1 or image number 2, Sharon?
It will be image 2 more inferior.
More inferior. Beautiful. So we see more liver, less liver. Less liver, more inferior. Make sense? Good. All right. So we're going to stop there. I'll pick up on the brain on Wednesday and maybe a little bit of Friday, because I'd like to make sure that you're prepared for your final. I know that it is a lot, and I know that it is foreign. But what is our objective? Know your projections. Know your slices. On your axial, again, this is what I said last week. Go from superior, or the week before, whenever I was last class. What is superior versus inferior on your axial slices? What is anterior versus posterior on your coronal? And what is lateral to medial on your sagittal? We will be covering thoracic and abdomen only. Thoracic and abdomen only. I do not expect you to look over the brain. We are going to spend some time on the brain.
Wait, did you say on sagittal? So sagittal,
it's medial to lateral.
you should see.
You're cutting off, Shannon.
You should be. You should go anterior. Posterior.
I'm sorry, John, and you were cutting off. I couldn't hear what you were saying. So, but I'll repeat it just in case. So for the sagittal projections, you're seeing what is
So
most
that
lateral.
answer?
Hmm.
Can you hear me now?
You're still cutting off a little bit.
I think I lost you.
Okay. Okay. So let me type it in just so that you make sure that you understand. On the sagittal, it is going to be from what is most lateral to medial. Mid-sagittal is mid-sagittal. So it goes from mid-sagittal or medial to lateral. Coronal. When you slice coronally, it's from anterior to posterior. And then for axial, right? When you slice axially, you're slicing from superior to inferior. So what does all of this mean? First, you're going to have to identify what slice you're seeing. And then you're going to be given some comparisons, kind of like what we played around with. One is going to sit higher, one is going to sit lower on an axial. You determine which one is most inferior versus superior. One is going to sit anterior versus posterior.
Cool.
You determine which one is going to be anterior versus posterior. One is going to sit medial and one is going to sit lateral. You have to determine which one is lateral and which one is medial. Make sense? But in order to do that, you have to know your anatomy. And you have to be able to make sure that you can find it on the new slice landscape. Everyone understand what I just said? Okay. Gotta shake off the holiday, people. We're back to business today. Back to business. So shake off the holiday. All right. If you have any questions, I don't mind answering them, but you have to ask them. Okay? All right. You guys have a good one. Just Lee, stop being distracted in my next class. You got a test. All right. See you guys later.